physician. I am a clinical nutritional specialist. I'm an author, I'm a speaker, and I've been doing that nationally for quite a while now. I've been in private practice with my husband in Norwalk, Connecticut for the past 13 years. And during that time, I have enjoyed taking care of my patients that have headaches, back pain, neck pain, numbness, tingling, and all the other conditions that you tend to think of when you think of a chiropractor. But for the past year, I've decided to challenge myself just a bit more and take on a condition that very few doctors have success treating, and that is migraines and headaches. See, I love taking care of headache patients. They are absolutely my favorite patients to treat. Probably because I was once a migraine headache patient myself. I know that nothing will ruin your day quite as quickly as a headache will, but medication really didn't help me much. It took some of the edge off sometimes, but for 6 long years, I took my doctor's prescribed meds and, well, nothing. So after a while, when the meds stopped helping completely, I felt like a sick child stuck in her room watching her friends all go out to play. It was awful, and I knew this was not the way my life was supposed to be. I was really lucky, though. I had found an awesome chiropractor, and that made a huge difference in my life. I combined chiropractic with improved diet, and well, my migraines are history. I was unique. My migraines were really the result of a car crash I had when I was 17. This caused a herniated disc in my neck. The mechanics were really screwy in my body anyway from a scoliosis surgery I had when I was 10. And that crash was all my head needed to make me have 15 or more attacks monthly. Headaches are tough. Migraines are tougher. And medication alone is really a dead end. Don't get me wrong, medication can be helpful. I'm not anti-medication. Meds can even be life-saving, but it doesn't make you healthy. And in order to kick your migraines to the curb and your cluster headaches and your chronic headaches out of your life forever, you first have to get healthy from the inside out. You must find and fix the problems, not just cover up the symptoms. So let's start tonight with a question that came in this week's email. And if anybody else has any questions, feel free to email me at any time. My email address is that's Dr. Slovin, Slovin, at yourmigrainedoctor.com. This first question comes from Jody, age 36, who writes, I get tingling in my hands and my feet on a regular basis, and worse, when my migraine is coming. So, what's causing this? My meds seem to make it worse. All right, Jody, thanks for your question. Tingling in the hands and feet can come from a few different places. Side effects from medication, they can definitely be part of the problem. Drugs like Topamax, these are common culprits. Actually, Topamax has quite a long history of side effects, including tiredness, drowsiness, dizziness, loss of coordination, tingling in the hands and feet, loss of appetite, bad taste in your mouth, diarrhea, even weight loss. And that's not even it. The laundry list keeps going. Topamax or it still has other problems like confusion, slowed thinking, trouble concentrating, nervousness, brain fog, speech and language problems. These things can also occur. I get really frustrated with these medications because the list of side effects is exactly what us migraineurs and headache sufferers are trying to eliminate. Sometimes it's impossible to tell if it's the condition causing the problem or it's the medication. And that's why, well, that's one of the reasons why medication long term is not the solution for handling your pain. There are too many side effects to account for. So, back to the question. Your thyroid is also a huge culprit for numbness and tingling. One of the big factors that interferes with thyroid function is chronic stress. I once had a patient tell me that they don't get stressed. But when you have chronic headaches or migraines, guess what? You have chronic stress. Headaches are stress, whether you think they are or they're not. There's an intimate interaction that happens between stress hormones and thyroid function. The more stress you are under, the worse your thyroid functions, period. So any approach to correcting poor thyroid function must address the effects of chronic stress and provide additional support for your adrenal glands. And we'll get into that later. The next major factor that affects your thyroid function is chronic inflammation. The biggest source of chronic inflammation is gluten. This is the protein that's found in wheat, in barley, in rye, spelt, or oats. It's a very common allergen, but it affects about 10 to 20% of the population. This reaction mostly occurs because of a damaged gut, largely because our diets are so bad and our stress. So, Jody, with regard to the numbness and tingling, it sounds like you need to look into some better thyroid testing. If your medical doctor refuses to look beyond your TSH levels, that's your thyroid stimulating hormone, which is typical for doctors to do, then call my office, set up a consultation. You obviously have a problem that's not being addressed, and finding another medication, it's only going to produce similar side effects, and it's not helping you. If you don't address the cause of the problems, you're just going to find yourself chasing symptoms all day long, and you're not going to get much relief. Your thyroid levels, basically your TSH levels, should fall somewhere between 1.5 and 3. Outside of these levels, there's a problem that needs to be addressed, and the problem is not what drug should you take next. Jody, I hope that answers your question. Thank you very much for writing in. I have another question. This comes from Paige in New York City. Paige writes, is it possible to have a migraine with all of the other symptoms but not the headache part? I'm nauseous, I have indigestion, I'm physically exhausted, my eyes hurt, and the pain just stays at a little peak right before the migraine, but nothing happens. Okay, Paige, thanks for your question. Hopefully you're on the line tonight, and if you're not, you'll hopefully be able to catch this on the replay line. The simple answer to your question is yes. That is totally possible to have all the symptoms of a migraine without actually having the pain. It's also possible to have an aura or an ocular or an eye issue where you see blurry or zigzaggedy lines, or you just feel dizzy without ever experiencing the headache. It's called an ocular migraine or a silent migraine. And some people have even called it an acephalgic migraine, meaning a migraine without head pain. In a silent migraine, the visual aura or some of the symptoms associated with migraine still occur, but there's no actual pain. So although the headache isn't present, it's still a form of a migraine, and it still responds to similar treatments that other migraines would respond to. So they're going to still be triggered by the environment. So anything that would trigger, a regular headache is also going to trigger an ocular headache. So stress, hunger, caffeine, alcohol. There are certain foods, a loud noise, bright flickering lights, or changes in the weather. The best way to treat these types of headaches is with the same natural methods that I would treat a full-blown level 10 on the pain scale headache. First, we have to start by finding a way to get you a good night's sleep without the medication. Benzodiazepines like Klonopin, they do a great job of knocking you out, but they don't do a great job of getting you into a deep, restful sleep. Secondly, we need to start with some of the simple things. You got to drink more water. I know, you don't need a doctor to tell you this, but most of us don't get nearly enough water in during the day. You should be drinking approximately half your body weight in ounces every single day. You also need to eliminate your artificially flavored products. This is your chips, your sodas, sauces, dressings. You have to become an avid label reader. Foods are not made with the same way today as they were made 20 years ago. You have to read every stinking label. And if you don't know what something is, you shouldn't eat it. There's also a really good chance that your thyroid and your adrenal glands are not producing enough hormone to help your body manage the day-to-day stress. Adrenal fatigue and migraine is tonight's topic. So let's just go ahead and discuss that now. Stress. All right, this is the core of it all. Let's first discuss stress. Everybody has stress. You can't live without stress. Stress is good, stress is bad. But persistent, unrelenting stress ultimately leads to adrenal burnout. Adrenal burnout and exhaustion render you defenseless against continual chemical, emotional, and physical damage that can occur with chronic stress. Traditional medicine alone, they don't believe in adrenal fatigue. They believe in something called Addison's disease. This is a disorder where that occurs when your body produces insufficient amounts of cortisol and aldosterone. It's a deficiency that usually results because of the actual destruction of the adrenal gland. It's a permanent disease. It usually occurs when there's a cancer or an infection like tuberculosis that invades and destroys the glands. But when your adrenals are so fatigued because of long term stress, such as chronic pain, you suffer more of a temporary insufficiency. And this is much, much, much harder to diagnose. And it, it's not the same thing, not even close to the same thing as adrenal failure. Stressed out adrenal glands can enlarge slightly when they're fatigued, but they really don't look any different when imaged. And they usually produce normal blood levels of cortisol. So, again, they're really harder to diagnose. So, for this case, I use special functional medicine tests that look at saliva, and these can more accurately determine or uncover any problems with adrenal fatigue. Weak adrenals supply adequate cortisol levels when the body suffers a little stress. But when you expose the person to major stresses, or somebody suffers from post traumatic stress disorder, the adrenals often flunk because they have no reserves. There's no more gas in the tank. And that's why saliva tests do way better than blood. And the special test that I do actually tests your saliva at 4 different times of the day and the night to help determine what your levels are within a 24-hour period. Your adrenals produce a wide variety of hormones, and these hormones are all essential for your everyday life. Acute or chronic long-term stress can compromise your adrenals. It can lead them into a condition called adrenal fatigue syndrome. So, what are the symptoms of adrenal fatigue? Well, adrenal fatigue is known to cause low blood sugar or hypoglycemia, hypotension, which is a low blood pressure, neural mediated hypotension, which is basically when you get dizzy when you go to stand up, fatigue, nausea, nauseated upon waking, where a lot of people feel better if they skip breakfast, then they crash. That's a problem. And often those with adrenal fatigue, they'll crave salt. And this artificially keeps your blood pressure up just a little higher. Adrenal fatigue can actually cause vomiting, constipation, abdominal pain, and often with kids, when we say that they have abdominal migraines, it's really adrenal fatigue issues. Diarrhea, adrenal fatigue can even cause muscle or joint pain. And I can't believe how many symptoms there are of adrenal fatigue, but still, other symptoms can be like you can lose your hair. You can have too much hair. This is, seen in men only. It can actually change the color of your skin and cause a hyperpigmentation. It can cause vitiligo, where it changes your skin color. It can cause auricular calcifications, where you can get those little calcifications, calcium deposits in the inner earlobe, GI disturbances, brain fog, low body temperature. That's also seen in thyroid, metabolism decrease, a compromised immune system, and a decreased overall sense of well being, like depression. So adrenal fatigue has a ton of symptoms, and the symptoms can sound a lot like low thyroid. So while thyroid is a huge player in migraine patients, it's a topic for another teleconference because it's not always the thyroid. Thyroid and your adrenals have to work hand in hand. If you treat only your thyroid and you treat your adrenals, you're not going to get very far. You'll start to feel better, then you're going to crash, and then you're going to wonder why. So let's talk about something called general adaptation syndrome. You've heard of fight or flight, right? Well, what we're really talking about with fight or flight is the first stage of the general adaptation syndrome, or the GAS phases. GAS can be broken down into three main categories. First is fight or flight. This is when you originally go into alarm mode. Your brain tells your pituitary and your adrenal glands to start releasing stress hormones like cortisol, adrenaline, norepinephrine, dopamine, and other stress hormones. Fight or flight tells your body to be on red alert. Your heart beats a little bit faster, there's extra blood flow that goes to the brain and to the muscles. Basically, your digestion stops, as does all other functions that aren't essential for the fight mode or the flight mode. So the second stage of GAS is your resistance reaction. Alarm reactions are usually short-lived, but resistant reactions, well, these guys can hang around for a while. Cortisol is the key hormone that's at play here. It's secreted by your adrenal glands. Cortisol helps increase your cellular energy, and it's a potent anti-inflammatory agent. The resistance reaction allows the body to endure what's going on for the stress. It helps you endure the pain, the fatigue, the injury. It lets you do this for longer periods of time. DHEA, along with corticosteroids, convert fatty acids, carbohydrates, protein. They convert this into energy. And these hormones increase your sodium retention or your salt retention, and therefore can increase your blood pressure when they're needed. They are also helpful in regulating your blood sugar. So now that you know this, doesn't it make a little bit more sense that when you have adrenal fatigue, you actually will have a lower blood pressure, and then the sugar levels in your blood test will likely come in high? It's not the sugar that's the problem. It's the adrenal fatigue that's the issue. Stage 3 of general adaptation is exhaustion. This is the result of chronic oversecretion of cortisol. This leads you right down the road of adrenal exhaustion. And adrenal exhaustion will lead you on a downward spiral towards poor health. Chronic headaches, migraines, nausea, allergies, allodynia, which is pain all over, to the point where your shirt hurts you, fatigue, dizziness, depression, low sex drive, chronic illness, cold hands, feet. These are just some of the symptoms of exhausted adrenals. The majority of patients I see for chronic illness like migraine, fibromyalgia, chronic fatigue syndrome, they are all suffering from adrenal fatigue and adrenal exhaustion. They have literally burned up their stress coping mechanisms, and between the years of poor sleep, poor diet, unrelenting stress, pain, fatigue, excessive stimulants, relying on a myriad of prescription meds, the adrenals and the chemicals they release, well, they're toast. They've been used up. They're not producing anymore. And once adrenal exhaustion hits, it's not long before the body really begins to break down. Getting stressed out and staying stressed out is the beginning of chronic illness for most, if not all, patients who have unshakable illnesses. So we could talk a little bit more about your adrenal glands, because these are the guys who we're talking about with regard to adrenal fatigue. Your adrenal glands are those small pea-sized glands that sit on top of each kidney. They're broken down into two parts. You have the inside, which is the medulla, and then the outside, which is the cortex. The inside, where the medulla is, this is where norepinephrine and epinephrine get developed. This is your adrenaline. They get produced in the medulla. These hormones are primarily used in the first stage of the general adaptation syndrome. And in the cortex, which is the outside, this is associated with chronic stress. So stage 2, stage 3 of GAS. The main steroid that we're talking about here is cortisol. The cortex of the adrenal glands, the outside, is also responsible for producing several other hormones: cortisone, hydrocortisone, testosterone, estrogen, DHEA, aldosterone, progesterone. The cortex is responsible for your resistance to stress. This is what helps you resist stress. It also helps provide you stamina for your day. So your cortex is going to regulate your insulin. It also is going to help with your inflammatory reactions. And lastly, it's going to metabolize your fats, your carbs, your proteins. And it's going to do that day in and day out unless you are missing the chemicals and you've burned them all up. See, long-term stress comes at a price, and its price will cause you poor health. Because once you hit adrenal exhaustion, there isn't enough cortisol to meet the demands of your body. So eventually, if you're very deficient, your body's going to step in and use DHEA to try to make up the difference. But eventually, your DHEA levels are going to burn up too, really quick. Your adrenal cortex, when it's healthy, produces adequate levels of DHEA. DHEA stands for dehydroepiandrosterone. That's a good hangman word, I think. But DHEA is really pretty important. It helps promote general well-being. It helps increase your energy, your sex drive, your resistance to stress, your immune system. They're all boosted by DHEA. You need DHEA because it helps to raise your cortisol levels. It improves your adrenal function. It improves your mood. And DHEA is needed for the production of serotonin. You've heard me say this before. Serotonin is your happy hormone. It's what makes you feel good. DHEA is also important because it helps increase cellular energy, mental acuity, muscle strength, stamina. So if you have brain fog, guess what? There's a good possibility that your DHEA levels are pretty low, because even in healthy people, DHEA levels begin to drop after age 30. By age 70, they're about at 20% of peak. Decreased DHEA levels correlate with your immune system, and they correlate with an increased incidence of cancer. So DHEA protects your thymus gland, who is a major player in your immune function, and it also prevents the destruction of the amino acid tryptophan. So with us, we take in 5-HTP, 5-hydroxy tryptophan, and DHEA is crucial in the development of preventing the destruction of the 5-HTP. And this is important because you need 5-HTP to develop serotonin. And with most of my patients who suffer from migraines, they are very deficient in serotonin, which is why they're taking an SSRI or an SSNRI. It's to keep the serotonin in the brain hanging around longer. I said earlier, serotonin is your happy hormone. It's a calming neurotransmitter, and it helps increase mental clarity, moods. It helps lower your anxiety levels. Serotonin is a major stress coping chemical. So you need it in order to function better, and you're not going to be migraine free until your serotonin levels come into normal levels. So how can you tell if you are suffering from adrenal fatigue? Well, there's a test that you can do at home to see if you're suffering. It's called a pupil dilation examination. You stand in front of a mirror in a dark room, shine a pen light in your eye, and if your pupil after 30 seconds starts to enlarge, adrenal fatigue should be suspected. So what do you do to help yourself after all that? Well, to help correct adrenal fatigue, there are 5 major steps. First, you have to drink plenty of water, about half your weight in ounces on a regular basis. Nothing else counts, just water. You can add lemon, you can add lime, you can add, if you have a histamine reaction, you can, add something other than citrus, but whatever you want, but it's got to be pure water. Number 2, you've got to get plenty of rest. You can't get well until you have a minimum of 8 hours of deep, restorative sleep on a nightly basis. This gives your adrenal glands the chance to rest and regenerate. But don't worry, naps count. So if you feel that you only get 6 hours a night, if you're able to nap for 1 or 2 more hours during the day, still good. Third, you have to reduce your stress, but you can't overdo it. There's typically, once my patients feel better, there's a tendency to go all out. You start doing laundry, you start running up and down the stairs, you go out shopping, you buy presents for everybody for Christmas for the next year, you go out and you mow the lawn. You can't be the Tasmanian devil. You're only going to wipe yourself out for the next few days. People come back to me the next day going, I feel great, I feel great, I feel great. Dr. Slovin, I feel great. Ugh, I feel awful. I crashed. It's because they pushed too hard when they're just getting started. You have to pace yourself. Now, this is the next one is hard. This is number 4, but you always, 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 always have to eat breakfast. You cannot skip a meal. You should never skip a meal. If you have adrenal fatigue and you're not hungry when you wake up, this is typical. All right, your body artificially inflates your cortisol levels in the morning so that you can keep your blood pressure up, your cortisol up, and that way you can kind of get by. But what happens is by 10 o'clock, you crash. So instead of eating a breakfast meal, you rely on soda, you rely on coffee, even cigarettes to kind of get you going. You have to eat no matter what. Even if it's just a small snack, even if it's just a handful of almonds and a bite of an apple, that's all you need. Then when you get hungry in a few hours, then you can eat another balanced snack until you can be tied over until lunch. But you absolutely cannot skip a meal. It's horrific for your body. Your body just goes into a tailspin. 5, use adrenal extracts to help repair and restore your adrenal glands. Adrenal extracts will help, and they've been used successfully in my practice for quite a while now. Everything from vomiting, dizziness, infections, migraines, asthma, poor digestion. They all can be remedied with proper adrenal extracts. So to buy what I use in my office, it's called Adrenal Cortex. You can actually go on the website. It's VIPdispensary.com. That's spelled out VIP dispensary, DISPENSARY.com. You will need a login code in order to access this because it's for doctors only. So you can use my login code. It is VIP dash B Slovin. So B Slovin, but no N. So VIP dash B like Brenda, S like Sam, LOVI. And you can purchase this same adrenal a cortex that I use in my office, or you can feel free to call our office and we'll be happy to ship it to you, whatever it is that you wish to do. So that wraps up my end of tonight's presentation. I hope you found tonight's information helpful and informative. And remember, if you have a question that you would like to email me, feel free to do so. You can send an email to that's drslovin @gmail.com. I am going to open up the lines for questions now. For those of you on the line, if you have a question, please type in *6. If more than one person speaks at once, just say your name, and after the first person speaks, I'll make sure that you get your question in too. Please remember, when you are done speaking, please mute yourself by pressing *6 again so that we can eliminate the background noise on the line. I am excited to hear your questions tonight. So let's open up the line. Give me just a second. And Almost there. Okay, you should be able to press *6 if you have a question. Okay, so feel free to press *6 if you have a question at all for me. Some people get nervous about asking their questions on the line, so you can always write them in and I can get back to you via email or read a question aloud for the future. Does anybody have any questions tonight? No? Okay. Sometimes people get nervous. That's okay. If you feel like you still want to ask me a question, but you're not sure about asking it online, that's just fine. Um, Feel free to email me. Again, that is Dr. Slovin at yourmigrainedoctor.com. That's Slovin, Slovin, at yourmigrainedoctor.com. And I look forward to speaking with you in the future. And I look forward to hearing your questions via email. And I look forward to speaking to you at our next teleconference on the third Tuesday of the month. Thanks, everybody. Have a good night. Bye bye.